Elon Musk's recent revelation that he uses ketamine for depression has reignited debates over the safety of this powerful drug, particularly in light of its growing popularity as a treatment for mental health conditions. While Musk insists that he takes only small doses under medical supervision, his comments could unintentionally fuel the normalization of a substance with serious risks. Ketamine may offer temporary relief from depression, but its potential dangers, ranging from dependency and cognitive impairment to life-threatening overdoses, should not be overlooked. The glorification of ketamine as a wonder drug obscures the reality that, like any psychoactive substance, it carries significant health hazards and its long-term effects remain poorly understood. Musk's admission comes at a time when ketamine use is already surging, both legally and illegally. Originally developed as an anesthetic, the drug has been increasingly explored as a treatment for depression, anxiety, and post-traumatic stress disorder. In 2019, the FDA approved esketamine, Spravato, a nasal spray for treatment-resistant depression, sparking widespread interest in ketamine therapy. However, many of the studies supporting its use are still in their early stages, and the drug's long-term safety profile remains uncertain. Ketamine has a well-documented history of abuse, and its dissociative and hallucinogenic effects have made it a popular party drug. The fact that it played a role in the 2023 death of Friends actor Matthew Perry underscores its potential dangers. One of the biggest risks of ketamine is its potential for misuse. Although Musk asserts that he only takes a small amount every other week under medical supervision, this controlled usage is not the reality for many individuals seeking relief from depression. Ketamine clinics, which have popped up across the United States, often administer high doses without adequate long-term oversight. Additionally, some individuals self-medicate, obtaining ketamine illegally and using it without medical guidance. This can lead to dependency, cognitive dysfunction, and even psychosis. The line between therapeutic use and addiction can be dangerously thin, especially for those struggling with mental health conditions. The short-term effects of ketamine can also be problematic. The drug induces dissociation, meaning users may feel detached from reality, which can be disorienting and even terrifying. Other immediate side effects include hallucinations, nausea, dizziness, and sedation. While these symptoms may subside, they can be unpredictable, especially when the drug is used outside of a controlled medical setting. Moreover, ketamine's impact on mood and perception can create a cycle where individuals feel compelled to take it repeatedly, increasing the risk of dependency. Long-term use of ketamine has even more concerning consequences. Chronic use has been linked to cognitive decline, memory impairment, and psychiatric disturbances such as paranoia and delusions. One of the most serious long-term effects is ketamine bladder syndrome, a painful condition that can lead to urinary incontinence and, in severe cases, permanent damage to the bladder. Increased blood pressure and heart complications are also potential risks, particularly for individuals with underlying cardiovascular conditions. These dangers highlight the fact that ketamine is far from a harmless antidepressant. It is a powerful drug with serious physiological and neurological implications. Another critical issue is that ketamine's antidepressant effects are not well understood. While some studies suggest that it can rapidly alleviate symptoms of depression, this relief is often temporary, and repeated use may be required to sustain its benefits. Over time, the brain may develop tolerance, reducing the drug's effectiveness and potentially leading users to increase their doses. This creates a dangerous feedback loop where individuals become reliant on ketamine to maintain their mood, which can quickly spiral into addiction. Musk's disclosure may also have unintended consequences by reinforcing the notion that high-profile figures can use powerful drugs without consequence. As one of the world's most influential figures, his statements carry weight, and his casual mention of ketamine as a way to get out of a negative frame of mind could encourage others to experiment with the drug without fully understanding its risks. This is particularly concerning given the current rise in ketamine-related overdoses and emergency room visits. While Musk claims to be using ketamine responsibly, his immense privilege allows him access to medical oversight and high-quality treatment, luxuries that many struggling with mental illness do not have. For the average person, self-medicating with ketamine can be far riskier, leading to dangerous side effects, addiction, or even fatal outcomes. The reality is that ketamine is not a cure for depression. It may offer temporary relief for some, but it is not a long-term solution, and its risks cannot be ignored. With little research on its sustained use and growing evidence of its dangers, it is critical to approach ketamine therapy with extreme caution. The push to frame ketamine as a breakthrough treatment for mental health must be balanced with a clear understanding of the potential harm it can cause. Otherwise, we risk repeating the same mistakes of past drug epidemics, where substances initially praised for their therapeutic benefits ultimately led to widespread abuse and devastating consequences. While Musk may be able to manage his ketamine use under controlled circumstances, the broader societal implications of his endorsement are troubling. Without stronger regulations, clearer medical guidelines, and a better public understanding of ketamine's risks, more people may turn to the drug as an easy fix for depression, only to find themselves caught in a cycle of dependence and harm. The conversation around ketamine needs to be honest about its dangers, not just its potential benefits, before it becomes the next widely misused drug in a mental health crisis already spiraling out of control.